this morning. To India now, where the coronavirus pandemic is putting extra pressure on the country's already overburdened public healthcare infrastructure. The extended lockdowns and a fear of catching hospital infections has prompted millions of Indians to turn to telemedicine. Nikhil Inamda reports.
Worried that she was showing COVID-19-like symptoms, Harsha Vardhani did something she would have never done under normal circumstances, logging on to a telemedicine app to consult a doctor.
It is really helpful to have the kind of expert diagnostics and the consultation that you can get because of the situation that we are in. We are under lockdown, we can't really go out, and it's really unsafe to go to clinics.
Harsha used MFine, an app that applies artificial intelligence tools to assist doctors in counseling patients on their smartphones and deliver prescribed medicines to their doorstep. Growing fears among patients about visiting infection-prone hospitals for face-to-face consults has prompted millions like her to turn to such apps. MFine's founder says the pandemic has helped to put a startup firmly on the map.
The teleconsultations grew massively, almost 5x in the span of roughly 6 weeks or so.
Of the 500 million odd Indians who own a smartphone, barely about 3 million do teleconsults. But some experts suggest that number could go up by as much as 10 times this year. New guidelines issued by the government recently are expected to go a long way in giving legitimacy to the sector, which operated in a regulatory grey zone thus far. But much more needs to be done to make access to such apps more widespread.
Among the barriers for adoption, I think the most critical is pricing. So if the government, employees and insurers actually cover this, I think this is the inflection point telemedicine has been waiting for.
But for telemedicine to become part of the mainstream in the future, India's health system needs a desperate infrastructure boost. There's an estimated shortage of 600,000 doctors and 2 million nurses. Filling in these gaps would be crucial so that the apps could work for the wider population. Nikhil Inamda, BBC News, Mumbai.